Good evening again. Today is Monday, October 23rd, 2023. And thank you all so much for joining in for can you imagine the fourth episode, the fourth series in this episode on Medicare Mondays? Wow. We have been learning a lot throughout the month of October as part of the National Health Literacy Month, and also as we get into this season of open enrollment, annual open enrollment for Medicare. And also, there are many other open enrollments in health plans that are going on across the country in the employer space. Um, and also in the Medicaid space, probably coming up. But we thank you so much for joining us, for tuning in, and we appreciate you for joining us again this Monday. We are, if you are the first time joining us, we have gone through several things, and we'll just do a quick preview so that you are able to know what we've done. And we will encourage you to go back, look at the other videos that we have worked on and presented on several um, facets of Medicare. So we appreciate you for joining us. We thank you for joining us. And on Medicare Mondays, again, my name is Dr. Prince Baawuah, and we have here Ruthlyn, Noel, Joseph, and we'll pass it on to Ruthlyn to introduce herself and tell us more about herself. But we appreciate her for the knowledge, for the wisdom that she's been sharing with us over the past month. And if you haven't subscribed already, we are. This is being streamed on the Heels Academy YouTube page, the Heels Academy Facebook Live. It is also on the Heels Academy and LinkedIn page, and also my personal LinkedIn page as well. And it's also being streamed on Health with Solutions, Facebook, YouTube, and you can join us. And also, again, our dear friend Otago Media is also streaming on his side, on his YouTube page for us. So we thank you so much for joining us, and I'll pass it on to Ruthlyn. I'll pass it on to you to introduce yourself and your organization with us, and we can move on for what we have for today. So Ruthlyn, I'll pass it on to you.
Thank you, Prince. Good afternoon, everyone. It's such a pleasure to be here again. I can't believe it is 4 weeks.
Yes.
But we've got a lot to do and talk about now that we're fully in open enrollment. So I'm super excited about that. My name is Ruthlyn Noel Joseph. My company is called Healthways Solutions. We're a licensed insurance agency that operates in multiple states. And our focus as an insurance agency is really to walk the talk with our clients, to handhold them through the process to make sure that Medicare is as seamless as possible for someone who is brand new to Medicare and coming in for the first time, or someone who's been on Medicare for a few years and have tons of questions. We are here to support and guide. That's our role. And in helping our clients to navigate this very complex part of healthcare as you age. So thank you. I'll pass it back to Prince.
Yeah, thank you, Ruthlyn, and we appreciate Healthway Solutions and the entire team for working with us. And at Heels Academy, we are a health system literacy organization trying to simplify the health system as possible with knowledge, with intelligence, so that people are able to make decision. Decisions that are based on knowledge that they have acquired for themselves and also for their family. So, Ruthlyn, we appreciate you for joining us today. We'll go through some of the things that we've covered in the fourth week. Week number one, we learned about the Medicare pathways and the paths, right? The parts broken down into pathways, and the pathways were easy for us to understand that the traditional Medicare pathway and also the Medicare Advantage pathway, and then you go through the part. So if you missed that, or even if you want a recap of that, you can always go onto the YouTube page, YouTube channel, or Facebook. The videos are there, and catch the video there. Week number two, we talked about the enrollment periods. And the question that came to mind is like, when someone is talking to you about Medicare enrollment periods, the first question you want to ask the person is, which one are you talking about? Because depending on where someone is, if they just say enrollment period, may mean different things. We learn about the initial enrollment period, the Medicare supplement open enrollment period, the general enrollment period, special enrollment period, annual enrollment period, open enrollment period. And we are in an annual enrollment period right now. So there are much more details and what that means to who on the YouTube videos as well. So please check that out and subscribe and share and let it be useful to you and also to others. We try to break it down in simplified form as much as possible. Last week, we went through the annual enrollment period because we were already, and as Ruthlyn said it earlier, we're already in the annual enrollment period. What should people expect? How do you prepare for annual enrollment period so that you can make the necessary changes that work for you and work for your family? And we talked about annual notice of change document, the ANOC. Is it how ANOC or is it yeah, letter document? You wanted to go find yours if you trashed yours and now you needed to know because that is telling you what changes are coming, um, and what are some strategies that one can take, recognizing your health need, looking at your current coverage as a baseline, looking at the providers, the hospitals, the medications, the pharmacies, the network, and meeting someone like Ruthlyn, or at least talking through what she emphasized last week that they provide free services. So I hope people are taking advantage of it as possible. And as the presentation goes on, we'll be sharing that link. I'll be sharing that link in. Please reach out to Ruthlyn, reach out to me, and then we can talk through it. It's for free consultation from Ruthlyn's place. So learn to to have the expertise of Ruthlyn and many others to be able to make the right decision for your Medicare decision that you need to make this annual enrollment period. So we thank you. We went through that, and thank you again, Ruthlyn. I always to say thank you because we I'm learning a lot, and I know many of our audience have been learning a lot as we go through this. So today, simplifying Medicare health insurance is cost sharing, right? We bear risk, and then you share the cost, but to understand the costs that are coming from 2023, 2024 that are coming compared to this year, you want to have a better understanding so that you are able to make the right decisions for you and your family. And Ruthlyn is here to break down the cost for us, to simplify it for us so that you are able to make the right decision for yourself, for your family. So understanding Medicare costs for 2024. And we go through the opportunity. Before Ruthlyn said we are in. So I will emphasize just a little bit on that Sunday, last week Sunday, right, Ruthlyn? It was last week Sunday, the 15th, and it
Yes,
goes
the
through
15th.
December 7th. And who is it for? Medicare plan enrollees, people who are already enrolled in to make changes. Ruthlyn has
Mm-hmm.
emphasized that over and over, so it's stuck in my brain. Um, so to reevaluate your coverage, to make changes to your coverage. If this is your first time signing up for Medicare, you are not in the annual enrollment period. You are in the initial enrollment period. I got this.
I love it. Love it.
I got this. So please reach out and as we are in the annual enrollment period, we are trying to understand how best we can take advantage and make it useful for us. And we still have till December 7th, which will come very soon. Time run very quickly. So we are trying to understand the cost, the coverages, so that we are able to make the necessary decisions for ourselves and our families. The opportunity, and I picked this from gov website, and it has this flyer there, and it is going on the Medicare open enrollment because we are in right now. So open enrollment is here, and if you read through it, it's telling you pretty much what we have been learning from Ruthlyn. Time to compare your plans, compare your coverages. Open enrollment is here. It's giving everyone the opportunity who is in Medicare the opportunity to make changes. Yep, make changes for the January 1, 2024 year. But don't delay. The open enrollment period ends in December 7th. then it asks, why is even plan comparison important? That just like your health changes, the plans changes, Medicare things are changing. So understanding the changes, understanding your health so that you're able to compare things for this year and even for next year for which coverage. And there are several resources on the Medicare.gov website. If you get stuck, Ruthlyn says they provide free services, and I'll emphasize that again. Reach out to her. I will send the link out, and then you can reach out to Ruthlyn or myself, and we'll get to you to help you navigate through that. So it is a great opportunity, and I will. I think is the only slide. I'm gonna pass it on to Ruthlyn. Takes us through the Medicare 2024 cost. So Ruthlyn, thank you again, and I'll pass it to you.
Thank you. Thank you. So, this year, we have a number of changes that's happening in terms of costs. Some costs are going up, some costs are going down. The one thing I want to point out to the audience is that when we're talking about Medicare costs, a lot of what we're talking about, or the foundation for our cost basis, is with original Medicare. And if you remember, when Prince briefly spoke about the two paths, individuals could start, or everyone starts out with original Medicare. That's your Part A, which is hospital coverage, and your Part B, which is medical coverage when you go see your doctors. So everyone starts out with A and B. It's on your red, white, and blue Medicare card. And so a lot of the costs we're going to be talking about today is really tied to Medicare, original Medicare. And then I'm just going to briefly, towards the end, kind of share some of the differences between, regular Medicare costs and the costs we hear about, and versus the cost in Medicare Advantage plans, and kind of point you to some of the things you need to look at if you do have a Medicare Advantage plan and is considering those. Just more high level than anything, because we can't discuss in this forum the actual costs for Medicare Advantage plans specifically. So we're just going to do some of the overalls. So when we're talking about Medicare costs, let's start with Part A. Part A is our hospital. And one of the first costs that individuals encounter when they are coming into Part A, and before I even do that, you often would hear that folks say that Part A is free. What we say is that Part A is premium free for individuals who have worked 10 years or have 40 credits. So that is the key here for Part A when we're looking at the cost, is that one, you have to have worked 10, at least 10 years. Those little, when you're wondering, why am I paying for Medicare on your pay stubs? You're building up credits, 4 credits every year. So if you multiply that by 10, you get 40 credits. So
Hmm.
you've built up those 40 credits, and now you're 65, or you're retiring and you're eligible for Medicare, and you have Part A, you have 10 credits, 40 credits, you're now eligible premium free for Part A. Now, not everyone is going to get to that 40 credits through their work history. And some of those individuals might have to pay to get onto Medicare. To be able to qualify for Part A, there will be a premium. Now it's adjusted based on obviously how many years you've already put into the system. But for those individuals who have to pay, the starting point is $278 per month to qualify for Part A. Now, if someone is eligible for Medicaid, if someone is eligible for the Medicare savings programs, they may actually have help paying for that 278. But if you don't have Medicaid or the Medicare savings program to qualify for Part A, and you don't have enough work credits, Based on where Social Security kind of determine the amount of years you have in, um, you may have to pay 278 or some adjustment of that based on extra years that you have. So when they tell you you have to pay a premium, that's what it's tied to, is that you do not have enough years on the books, so to speak. And so now you have to pay to catch up to be able to continue to get Part A or get your hospitalizations covered under Medicare. Right. So that's the first cost that individuals tend to encounter. We get a lot of questions about it as to why do I have to pay for Part A when my neighbor does not have it? And that's because that's the problem. This is a huge problem in terms of the cost because for many new immigrant communities coming in, individuals coming in, a lot of times they don't know about Prince, the Social Security and how that relates to their payments. And so we get a
Mhm.
number of immigrant customers coming in who don't have enough work history because they
Work
probably
history.
didn't work enough on the books, so to speak, and have these
Mhm.
payments to make. So when in doubt, I'm going to advise everyone, when in doubt, if
Seek
don't
help.
assume that you don't qualify for help. Ask the agent, ask the broker, or even ask the carrier that you're working with, is there any help available for me to be able to cover my premiums for Part A if you're subjected to that? Chances are you're entitled, or you're, based on your income, you're eligible for some kind of help to help you offset those premium
Early
costs for
period.
Part A. So don't assume. Let the paperwork go through and let them see that you qualify or not, or give you that determination.
Okay. So just a
Mhm.
recap, we are
Part A.
discussing the pathway traditional
Mhm.
Medicare. And just for those that are joining us for the first time, please watch our very first video that we went through the pathways. But this is traditional Medicare pathway, and on that pathway there is the parts that we know. Part A, which is the hospital one, or what pays for the hospital
Right.
um, bills. Like there is a premium to it, which is starting 278. Ruthlyn, do you know, or do you have an idea how the scale goes? Like 278 each month. It started at
I
278,
think someone
and
within like 5 7 years
okay,
will come closer to that 278, but someone closer
okay.
to 10 years, maybe a few credits short, the amount is going to be a lot lower than the 278.
Oh, okay, okay. Does it go higher than 278,
Um,
or oh yeah, yeah. Okay,
well, if you have no credit
no
whatsoever,
credit.
you
Okay,
you could pay. Well, actually, yeah, if
actually,
you have, well, it starts this year at 278.
it start.
So
Okay,
278 will
okay.
be the baseline,
The
and then it
floor,
will go up,
and then it goes
and then
up.
it will go up.
Yeah, go up.
Yes,
Okay,
that's what
okay,
I'm thinking.
yeah,
So
yeah. All
strike the
right, cool.
previous comment.
Okay, no problem. So it's a floor,
This
and
is the floor.
then so the closer you get to the 10-year, the credits, the closer you get to the
Right,
278.
right,
Otherwise, it just go up
right.
from there. Okay, and then ask the experts, fill out the forms if you need help.
Mhm.
There might be
Help
some
available to pay that.
available to help with some of these costs. All right, thank you so much.
Okay.
All right, we'll jump to the part. I think more on the part.
Yes. So we're still on
Ruthlyn,
the
hold
part
on.
A. Mhm.
Before we go back, let me quickly go back. I know we're talking about pretty much what you're paying for them every month, right? So
Correct.
I just wanted,
Yes.
because there are several cost areas here. Premium is one of the cost
Right.
area, right? And now the
A premium is your monthly payment,
next
what you're going
ones
to be
are
expected to pay
like
every month.
deductible and
Correct.
yeah, monthly payment.
Correct.
And what is, if you don't mind explaining a bit about what a deductible is,
Okay.
and
So
co-insurance, how
the
is it different? And then we can go to the
correct.
different payments in that.
All
Yeah,
right. And then we're going to add one piece here too called a copay, right?
copay.
So a deductible is really, ideally, it's the amount you pay first before any kind of insurance plan will start picking up your costs. For Medicare, the deductible is one of if you're hospitalized based on Part A and you trigger a hospitalization, you will have a certain amount in a deductible to pay first in terms of medical bills.
Mm-hmm.
And then once you've covered that or you've reached that limit, then Medicare will start picking up the cost. A
Mm.
co-insurance is a percentage of the cost.
Okay.
So you go to the doctor. The Medicare says it's more tied towards Part B, where we see that Medicare pays 80%. We'll talk about that. And you, the individual customer, you pay 20%. So a co-insurance is a percentage. And the difference between a co-insurance and a copay is a dollar amount.
Okay.
$10, $40, $50, right? Uh, $500. But the co-insurance is always the percentage.
So, just that doing the math easily, um, if so, the cost would determine for a co-insurance
Hmm.
whatever the allowed amount or whatever the cost of the care is, because this is a percentage. That percent, the amount would change as well, because
The
$1,000, 10% of
correct,
$1,000 is different from it. Maybe it's the same 10%, but for a $2,000, that same 10%, the amounts are different, right?
correct.
But for your copay, the amount is the same regardless.
Right. You would know your copay and you know what you have to pay on a monthly basis. So what I say to my customers all the time, Prince, about copays and co-insurance is that I could do my budgeting in copays because
Okay.
I know if I'm going to the doctor 10 times for the year, I know that and I'm seeing a specialist and I have to pay $50 every time I visit the specialist. I know
Hmm.
exactly what my costs are, right?
Okay.
So
Yeah.
it's easier for me to budget and do some prediction.
Hmm.
With a co-insurance, it's much harder because you don't know exactly how much the doctor is actually billing the insurance carrier. So how much of that bill is your responsibility? All you know is that you might have a 20% or a 30% or a 40%, but 40%,
Of
20%
what?
of what?
Yeah. Yeah. Yeah.
Right?
Yeah. Yeah. So I hope people are understanding it. Co-insurance, copay, I think copay dollar amount, co-insurance
Right.
percentage amount. Yeah. Percentage. Yeah.
Correct. And even with Medicare, Medicare does have predictable kind of like premium, kind of like rates set.
Okay.
But even still, for the average consumer, it's hard to say if I have 20%, what my 20% is, because you have to still know the service. So I like copays, but this is what we deal with in our world. We have both. Um, and so we just know that we have the 20% and we'll work with what we've got.
We've got, yeah.
Right.
Okay. Okay. Yeah.
Okay.
So if you don't mind taking us, and I wanted to help explain the terms so that people, our audience, have a better knowledge, but please take us through it. Yeah,
No
and I'll
worries. This was
translate.
great because we needed to have a conversation around that. So now for your Part A. So this is your hospital coverage. You have your monthly premium if you do. If not, if Part A is free for you, then it's free for you, premium free for you. Then that's it, right? So you have your premium monthly. Then you go to the hospital. Maybe you've had a hospital stay or two. Um, and now you're triggered a deductible. So for 2024, the deductible under Medicare Part A is $1,632, right? And it's kind of broken up a little bit too, based on how I would say what's going on with you and your days in the hospital. So from day 1 to 60, after you've paid your Part A deductible, um, it's $0, right? So if you stay in the hospital for 60 days, you still have that 1632 deductible. And once you've paid that, then those costs will be $0 for 60 days. Days 61 through 90, there is a copay that you would pay on top of the deductible for each day you stay in the hospital, which is $408 copay per day, right? On day 91 through 150, the copay amount is $816 each day that you're in the hospital. So you're using up some of your reserves during that time frame. And after 150 days, you're paying 100% of the cost, whatever that hospital bill is. It's so important that if you have Medicare Part A, or what we would call original Medicare, that you understand what your costs are, especially in that. Because, Prince, if you do not have Medicaid as your secondary to
Mm-hmm.
cover those costs for you, or you do not have a Medicare supplement plan to cover those costs for you, you're on the hook for paying all of
All
these
these.
extra costs,
Huh.
right? And how they add up. So when you see someone is in the hospital and the hospital is trying to, I don't want to say kick them out, but gently move them to a different care setting, that's what they're looking at. They're looking at, okay, you've used up your 60 days in the hospital, so that's your 2 months. Even though your health might not be changing, you might want to appeal this. But once you go past that 60 days, you have a copay. So unless you, the individual consumer, has another alternate coverage to help you pay that copay, think about what $408
Per
is
day.
times 5 extra days.
Huh.
And that's out of pocket that you will have to pay.
Huh.
All right. You had a question. You're doing the math in your head, Prince. I'm
I
seeing you.
I'm just doing the math in my head. I'm just doing the math
Right.
in my head because it's as you said. If you don't have the a supplement plan to help you, or even a secondary plan to help you, that's like the next is 408 per day. Yeah.
Yes. Yes. I didn't want to like say the number, but that's where folks tend to have like sticker shock as to, oh, I thought Medicare was free.
Free. Yeah.
I get that all the time. And I had a hospital stay and I have this huge bill. What I supposed to do. I had someone come to me, Prince, and they had several days in the hospital. But they did not have a secondary in place.
Mm.
They did not have a supplement in place. And the bill came out to $95,000.
Wow.
And the reason being is that Medicare, original Medicare, does not have a cap. Okay?
Okay.
Original Medicare plans, folks, do not have a cap on how much you could get billed. So you're paying these limits, but if you're there for any extensive period of time, know that there is no ceiling where Medicare is going to say stop. The ceiling is on the Medicare Advantage plans. It's not on original Medicare. So it's so important. Before I move on one last time, it is so important that if you're just with original Medicare plan, you only have a red, white, and blue card, that you have a secondary plan, meaning you have coverage through a job that's helping you pay for that extra premiums. You have a Medicaid plan that will pay based on, but Medicaid is based on need, or you have a Medicare supplement plan that is going to pay these out of pocket costs for you. Otherwise, you will be on the hook for all of
All
these
these
extra
extra
costs.
costs.
All right.
Yeah.
So I think I've drilled into that enough. So let's go
Yeah.
into
Let's go to that.
let's go. I don't want to be the bearer of bad news. So let's go
Yeah.
to part B.
Yeah.
Uh,
Now, so let me quickly. So we are in pathway, traditional Medicare pathway. We've looked through the part A, which is the hospital side. We have looked at the premium, right, which is the monthly payment, and then on the other side, we're looking at some of the co-pays that are being paid per day, right, and the
right,
deductibles that are being paid. So that is on the hospital side, and Ruthlyn has gone through this with us on the very first couple of videos. So please, 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 if you are catching us today, you want to check out those other videos that will be in the description. um, in the post description on YouTube. So please, you can always check that out. So now we are moving from the hospital side to more of the physicians and the body
Labs.
people doing the yeah. So
Correct.
and that is what the part B covers. All right. So you can, Ruthlyn.
Okay. So now we go to part B. And now for part B, you have a premium, right? The part B premium is going up slightly this year. So it is 174.70. And for higher income individuals, individuals making over $97,000, Prince, a year,
Mm-hmm.
um, they will have what's called an income adjustment that will adjust their premium. In other words, there will be an add-on to that base level, and it varies based on in different income ranges. And if folks want more information on that, you could reach out to us. But just know that if you're making for an individual over $97,000, you will have that income adjustment tacked on. It's just a few dollars extra, so it'll be the 174.70 plus $12 and change, and whatever those going up to.
But
But for Part B, there is a premium. Now with Part B, and most people are familiar with the Part B premium because let's just face it, the majority of people who come into Medicare Part A
mm-hmm.
is premium free. So Part B gets taken out of your Social Security. That's how most people have it. I mean, you could set it up to where you make the payments every month. But if you're already collecting Social Security, it's just easier to have Social Security take that payment out of your Social Security payment, and then you don't really have to worry about writing a check to the government every month to maintain your Part B. And remember how we use Part B. Part B, we're using it more than anything else because we're going and see our doctors. And what's the one thing that people over the age of 65 do more than anybody else is go see doctors, right? You have
Yeah.
lots and lots of doctors that you have to go see. So you want to make sure that your Part B remains intact, right? Because you want to be able to go see your doctor. You want to be able to go see your specialist. You want to get your labs. And so that's where it is. So it's 174.70 per month is the Part B premium. And then on top of the Part B, there is what's called a Part B deductible. All right. And the deductible is taking a price increase again. Unlike last year, we had price decreases. We're taking a huge hit this year on the Part B deductible.
Mm-hmm.
It's $240 this year. That's up almost almost $10. I think over $10 when I'm doing my math in my head. I'm looking at different numbers. But that's a huge deductible. That's a huge price
Change,
increase
price change increase.
um, for someone on a limited income. So the deductible is 240. And again, the deductible is the price that you pay first. So now you're going to want to think a little strategically. If you only have Part A and Part B, which doctor is going to trigger that deductible for you, right? Because if you make your first appointment, your primary care physician, there is a good chance where you go to your PCP and you're saying, oh, but all of my, I'm getting all of my annual checkup, which is supposed to be no cost to the individual. Those are all there. But because you still have a deductible, you may have to pay that PCP that 240. I get calls like that all the time. So think strategically about if you do have original Medicare, which is the first doctor that you want to generate and run that deductible for you, because it's going to be pulled in, so to speak. Now, if you have Medicaid, both the premium for Part B and the deductible will be covered by Medicaid.
Okay.
If the individual has or enrolled in the Medicare savings program, the Medicare savings program will include, depending on the level of Medicare savings that they have and the program the state um, local social services department enroll that individual to in. They will either have both the premium and the deductible covered for part B, or just the premium covered, right?
Hmm.
But you may still have to pay the 240. And now, if you have the deductible, the $240 deductible, we had spoken before about the Medicare supplement plans and what's covered in the different parts. Now, if you were enrolled in Medicare prior to 2020, if you were eligible, I need to say eligible. If you were eligible for Medicare prior to 2020 and you have a Medicare supplement plan, Plan F, you will have no extra cost because that Plan F is going to cover both the premium and the deductible. If you're brand new to Medicare as of 2020, so you became eligible after 2020, um, you may have to pay that deductible still on that Medicare supplement plan, right?
Why? If you don't mind explaining why, you know.
It's just a rule change to
Okay.
make sure that the individual has a stake in the game when it comes to Medicare.
Medicare.
And
Okay.
that's the easiest way to put that. So
Okay. 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 Okay.
so there is that portion of that cost that the individual will have to pay. All
Okay.
right. So that's the only change from Medicare supplement. So and I say to every individual, if you're struggling with paying, ask a question, because chances are that you could still be eligible
For
for one of the assistance programs that's available through your state, through the federal government. Um, you could even go back to the government, and it's a hardship for some individuals, and let them know it's a hardship. So when in doubt, ask questions, because I know these costs can be quite significant
significant. Yeah.
um, when individuals are dealing with those costs, right?
Yeah.
So go ahead.
No, no, I'm just listening to you and looking at all the costs, because now looking at the part A, and as you said, as you age as a variable, as you age, you get into Medicare, you know, you are
Right.
getting a lot of healthcare.
Hmm.
So pulling all these deductibles and premiums and co-insurances and co-pays together from A and B and pulling them together. Like for example, you just talked about a 240 with the increase. Like
Hmm.
now, if you are your social security check is where the premium's taken from mostly, then y- you've gotten a hit from basically from what you used to receive, right? And that affects how much disposable income left for you within a specific point in time in the
Yes.
coming year. Yeah. So
Yes.
understanding these costs and how they strategically affect an individual's disposable income over time is very crucial. Yeah.
Correct.
Yeah.
Correct. And I don't want to scare folks, Prince, because we do have now. Remember your Medicare costs. So Part A and Part B costs; those are separated. You're still going to need drug coverage,
Well, coverage. Yeah. You talked about that last time.
and drug coverage has its own set of costs because it's a standalone plan. And if you have a Medicare supplement, you have its own. Medicare supplements have their own costs because those are on top of Parts A and Part
A
B
and B.
costs, right?
Hmm.
The key here is that many of these costs, if you do have a supplement or if you do have a secondary, all of those costs where we just spoke, most of the costs that we just spoke about for Part A and Part B could be covered under a supplement, or will be offset by a secondary plan, some kind of other coverage that you have that's helping you pay for those Medicare costs.
Yeah, you are using terms here, and I want to bring them up because so that you can better explain.
Right.
I know you've done that over the last series
Mm-hmm.
or the series before, but so your supplement and secondary,
Right.
the two S's. Do you mind explaining just briefly?
Absolutely.
Yes, the supplement. Okay, if you want this cost, you can get some supplement for it, or you can have
Okay.
secondary.
All
Like
right.
explain the
And
difference. Yeah,
and I'm
please.
using supplement because so many people come to me and they say, "Oh, I have a supplement," and but it, and then they give me the carrier and they give me the name that they have, and what they actually have is a Medicare Advantage plan,
Mm-hmm.
because because they don't on most people do not understand the difference between a Medicare supplement and a Medicare Advantage plan. So
Uh-huh.
when I say supplement, and what the Medicare supplement plans do is that they are set up, and yes, they're run by private insurance companies who have a contract with Medicare, but the Medicare supplement plans, their only purpose here is to help you cover your share of the out of pocket costs for Part A hospital coverage and Part B medical insurance.
Okay.
That's all the supplement plans do. So if you have prescription drug coverage, because this is the other piece that someone will ask, so I have a standalone Part D plan, the supplement plan does not
Doesn't cover
cover those
mm,
unless that medication is covered under
the
Part
part
A
A or
or
B.
Part B,
Mm-hmm.
right? So the supplement, we say supplement because it supplements your costs for Medicare Part A and Part B.
Okay.
All right.
Okay. So let me rephrase. So the supplement plans are supplementing. It's more like cost supplement plans, if I may use that
Right.
term. So they're supplementing the cost that one would have had with the premiums and the co-insurance co-pay things, but they are not supplement. They are not Part D like your drug stuff.
Right.
They are
Right.
supplementing these costs. So
Right.
cost
Right.
supplement for A and B. Okay.
Right. So think supplement as only paying things that you have to pay. The supplement will
The
only pay
individual.
what you have to pay.
And with that, you are paying premium for them to cover
And you're paying a separate premium depending
separate
on the
premium
different type of
supplementary
supplement plan
plan.
that you have. And you
Okay.
recognize the supplements by the letters. There
Okay.
is a plan A, there is a plan B, there is a plan N, a plan G. So you recognize supplements because they're going to be labeled as plan something.
Okay.
Plan N, plan A, plan G, plan F, right? So that's how you recognize the supplement that you do have a supplement,
Okay.
right? It's also a little bit more expensive than a Medicare Advantage plan in certain cases. So you want to make sure that you're doing the math and make sure that the supplement is affordable for you,
For you. Okay.
right?
All right. So supplement, and now take us to the.
Okay.
I think was it secondary? Yeah,
So
secondary.
the secondary payers are payers that's more or less the easiest way. They help you with your out of pocket costs as well, but they're different in nature in that they could help you pay for a number of things, including your prescription drugs. So we're looking at programs, most of them are programs. So we're looking at programs like Medicaid,
Okay.
right? And Medicaid works around Medicare as a glove, so to speak. So whatever Medicare doesn't, what when Medicare pays first, then the secondary payer will step in and pay the balance
Okay.
up to whatever conditions that you have on the
And
plan
the
that you
plan.
have. So in the
Okay.
case of Medicaid, they will cover most of your out of pocket cost.
Okay.
um if you have if you have a secondary plan through your job, because maybe you have Medicare but you're still working and you're still signed up on your employer group plan, the group plan or the union plan will pay the difference in that. So they still work around Medicare. Medicare may pay first, Medicare may pay second. It depends on what the nature is
Um,
of the
this-
employer. but that secondary plan is working in cahoots, so to speak,
Mhm.
with in conjunction with Medicare to lower your out of pocket costs. It may not be 100% all the time as it is Medicaid, because in some of your group plans you may have a copay to pay on certain things, but it's going to work around the Medicare. Medicare, it determines whether or not Medicare bills first, pays
Mhm.
first, and then that secondary will pay second.
Okay. Okay. And that is also different from the part D, like drug
Right,
plans.
right.
Right.
So your secondary, in most cases, the secondary will also cover whatever out of pocket costs the individual have when they fill prescriptions.
Prescriptions. Okay.
Right.
Okay. Thank you so much. Yeah. I wanted to, like, they all start with S, supplement, secondary. Maybe the part D wasn't, but yeah, it's just as the terminologies are being used, as you use
Right,
them, like help. Oh, this is a a supplement plan, and therefore it's covering only A and B.
right.
Why can I use the supplement for part D? Then you get frustrated. You thought you were
Correct,
gonna use it, but then it is not set up for that. It's set up for A and B.
correct.
But if you have a secondary,
Right,
then that potentially cover all of them. But it all depends on knowing which one you have, which one you purchased
correct.
as an individual, so that you don't have any unmet expectations and feel bad that something didn't work. Maybe you
Right.
didn't take note of it, but with that
Hmm.
understanding, it can help you to better know what something is for, knowing the
Right.
right tool for the right work. Okay, thank you so
Correct.
much.
And know that individuals could have a Medicare supplement as well as a secondary as well.
Yeah,
Um, I don't always recommend it. I think you need to look at your budget to make sure that it makes sense, because remember, you're still paying for a Medicare supplement. And if you have a secondary through the job, you're probably still taking money out of your
the
paychecks,
paycheck.
right? So this is one that you have to look at very closely to know if you need both the Medicare supplement and a private secondary or Medicare Medicaid second acting as a secondary plan. You need to be do your budget first, because in most cases you will find that if you have Medicaid, you do not necessarily have to pay to continue on a Medicare supplement. So do the numbers and see what makes sense. But there are all reasons why someone will keep both the secondary and a supplement. But definitely, you want to look closely at what you're doing there.
Okay, okay. And just a quick question. So, if someone has a Medicaid, that's not a supplement.
Medicare would
That
be
would be a
considered
secondary.
secondary.
That would be a secondary. I'm
Right,
trying to make sure my brain I'm
right,
understanding it well, because Medicaid is another insurance
right.
that will be a more of a secondary that is
But
covering everything.
here's the thing about Medicaid is, and we could talk Medicaid all day, all night, right? And so I'm just not going to go that deep into Medicaid. Medicaid is always a payer of last resort.
You
So
mentioned
if
that last
you
time.
as an individual keep a supplement and you have Medicaid, um, the supplement might have to pay first, and is what's left over that might go towards the Medicaid for Medicaid to pick up.
Mm,
But if you're paying 100 and I don't know, gosh, $150 a month, give or take, to have a certain type of Medicare supplement plan, um, how valuable is that? Unless you need long-term care, how valuable is that to keep that supplement and still be eligible for Medicaid? You're using up a lot of your social security
resources.
dollars there, um, using it for a supplement when you could put that money towards good use,
Hmm.
right? So that's why I say think carefully, folks, about having both a plan like a Medicaid plan and
Mm-hmm.
having a supplement. Not that you cannot, not that there aren't certain situations where you should, or you might need to have it, but for the vast majority of people, it's not necessary to have both a supplement and a secondary plan.
Secondary. Okay. Okay.
All
Thank
right.
you so much. Thank you so much for breaking this down. Um, I like the review, so I'm gonna go back. So today we are covered mostly on the traditional pathway.
Traditional path.
Traditional pathway. It is the annual enrollment period again from October 15th to December is the 7th.
December 7th.
December 7th, and changes are here. There are changes, and this is the opportunity. There are changes in coverages across the board. So, as an individual, you've gone through another year, and there are changes that are maybe upcoming or things that you have recognized about your health compared to the plans that you have and the coverage that you have, either from the traditional pathway or with the Medicare Advantage pathway. But today, we focus on some of the costs in the traditional pathway, and we started just from a general. And I like to go across. So, premiums. We've been talking about premiums, which is the monthly payments that you one is making, taking mostly from your SSA check instead of mailing check to the government. So premiums. Then we looked at the deductibles, the co-payments, the co-insurances. Um, we looked at the part A, which is the hospital. We talked that um, depending on how much credits that
Hmm.
one may have, your part A, you may pay the premium was that true? The premium may change based on the part A.
Bas-
I'm
you lost me.
going back to refresh myself. That is, yeah. If
Your
you have a
premiums.
qualifying work history, then that is free, but then it starts from 278 each month without
Correct.
work
Correct.
history, and then it can go up. I'm doing this review just in case late, but please go back and watch the videos because it's always amazing of the information that Ruthlyn shares with us. But then there's the deductible and the co-insurance, and the deductible for every benefit period. Sorry, it's 1632 for every benefit period, and it goes through this. And as you get care and you add these things up, these can be very, very significant. So knowing these costs so that one can make decisions are very important. Then part which is the seeing your physicians and the NPs and all the labs and other things. Um, with premium that start in 174.70, and then there are change depending on your income, it might be
A little higher.
more.
Right.
Then part B, co-insure 240, and then 20% co-insurance because it's a percentage.
Right.
Uh,
Right. And so
and
that
then that
20%,
is
Prince, let me give you
go
some
ahead.
numbers on that 20% because that's where the piece that everyone
No
gets to.
problem. Go ahead.
Everyone says, oh, Medicare pays 80%, and the 20% is what the individual pays, but that only applies to Part B,
Oh
not
no,
Part A.
no part eight.
All right.
Yeah,
Sorry, go
yeah,
ahead.
yeah. The part A1 was pre.
The break
Sorry, was a co-pay, right?
was the
And then the
co-insurance
breakdown
and the
into the various
co-pays and the
co-pays
breakdown.
depending per day.
Correct.
And the copay, yeah. And then it goes down, yeah,
Mm-hmm.
depending on how many days one have in the
Right.
hospital, and which gonna is like more than a 4-star hotel stay. But definitely, if you have, we shared the links over on the various channels on YouTube and on Facebook. So if you please have any questions, if there are any questions that are coming, people have, our audience that are watching now have, you may please go ahead and put in the chat and we can discuss it. But otherwise, we continuously send the link out. I have posted it on YouTube, Facebook, and also on the Boy channel. So please use them to reach out to us, reach out to Ruthlyn, and also if you have any questions and you want to follow up, the websites are here. Ruthlyn's website is the healthwithsolutions.com, support at healthwithsolutions.com. Can easily reach out to her and her team, and they are always ready to be of support. And if you want to reach out to the Hills Academy, website is thehillsacademy.com and info at thehillsacademy.com. But we sincerely appreciate everyone. We hope today was helpful. We talked a lot about the cost. If you get confused, if you get confused, please seek the experts out. If you get checked out this evening when we're going through the cost, please check out the experts, because they are there to be of help, they are there to be of support, and Ruthlyn and her team are there to educate us, to inform us, and also to be of help to us. So definitely, I hope people are preparing. If you are in Medicare right now, or you're preparing towards it, or even you don't have to get to 65 to be learning about these, because it helps you prepare yourself to some of these costs so that you can have a better financial planning for future, because it helps you to prepare as such. So thank you so much. I know we have only 5 minutes. Ruthlyn, any final shout outs to anyone, final words to leave us with?
You know, I know Medicare is complex. I know it's hard sometimes to break it down in its increments and try to understand and make sense of what you're trying to do and navigate the system. That's why we're
Mhm.
here. We might get some questions. I anticipate we'll get some questions. How come you didn't talk about the Part D? I think Part D is its own topic because it comes with its own confusion. So we'll cover Part D on a separate call, conversation, and work through how the cost ties in for it on its own.
Okay. Yeah, we sincerely appreciate your time, Ruthlyn, and we thank you for your knowledge and being generous to share with us. And we want to say thank you again for joining us on Medicare Mondays, and our audience that are joining us live, or those that will watch this episode later. We also appreciate you for your time and for the learning. And if we don't have anything else, we thank you, and we will see you all same time next week as we learn more about Medicare. Thank you so much for joining us, and we'll catch you all next week. Bye
See you
then.
next week.